My name is Pauline Long, and I'm the social media and communications consultant for Sisters Saving Ourselves Now and Black Women's Roundtable. And we're here at the Black Women's Economic and Health Symposium that is sponsored by Gateway Medical Society, which is now Highmark, and is sponsored by several other entities, the Heinz Foundation, UPMC, and I'm hoping I'm not missing anybody, but there's a couple more people. And we're here because over the last couple of years, there's been several research studies done by the city of Pittsburgh in conjunction with the University of Pittsburgh, saying that based on 89 cities that were a part of the study, Black women have the worst conditions here in Pittsburgh. We're the worst city for Black women to live in the entire country. And we're trying to do something to change that. So one of our presenters today was Ms. Edwards. Would you introduce yourself?
Hi, everyone. I am Ashley Edwards. I'm a master's marriage and family therapist. I also am a professional life coach, and I practice life planning and family planning. I am also a spiritual advisor and Reiki healer. Where I currently work is at a private practice. I am currently taking clients focusing on minorities and those that are facing social injustice.
All right, that's a mouthful. And you did your presentations on mental health and the traumas associated with that.
Yes.
And what I'd like to know, though, before we talk about your presentation is, besides your presentation, which was excellent, what other presentation did you hear today so far that you thought was excellent also?
Absolutely. I really enjoyed the URA presentation. They were presenting about providing loans to new small businesses and also to businesses that have already been thriving but may have been in some sort of recession due to the pandemic. They are also doing a lovely project on restoring certain communities and providing money to those who want to contract and build up those homes and those businesses in certain communities. And I really appreciated that presentation.
And that is so good. And just in case there's somebody out here who doesn't know what URA is, it's the Urban Redevelopment Authority of Pittsburgh. And they have a multiplicity of programs other than just neighborhood redevelopment and providing loans and building houses. But let's talk about your presentation just a little bit and mental health. You know, there's been a stigmatization, I think, for Black people to use the word maybe crazy, and they don't want to go and get therapy. And Sisters Saving Ourselves Now, Black Women's Roundtable, we have created a database of Black female therapists. And we're advocating, and I know along with you, that people, almost all of us probably need to go get therapy, whether it's individual therapy, therapy for our children, or family therapy, because with Black on Black crime and racial discrimination, we're all traumatized in some kind of way.
Absolutely.
And whether we need a couple sessions or several years, but there's this stigmatization. How do we get over that?
Well, I just want to let everybody know that if you are in therapy, it does not mean you have some severe diagnosis. Therapy is a wonderful, safe space to talk about family issues, to talk about your personal issues, hash out any past traumas or new traumas, and learn new ways to exist. It also doesn't always mean you need medication or that you have to move out of your community to be able to function and heal. It is a nice space to learn about yourself, your spirit, and your physical. And it is also a great space to just commune with somebody else who has an understanding and can hold space for you to be vulnerable.
I get a magazine called Psychology Today online, and so I learn a lot of things from looking in there. And one of the things that it talks about is the different kinds of depression, the different kinds of therapy. And one of the therapies that I think I utilize all the time is talk therapy, where it says you're not laying on the couch with a psychologist or a therapist. You're just talking to your friends, you're interacting. If you're in college, you know, sometimes as a high schooler, you can't just talk to your friends because whatever problem you have, they have not had enough experience to probably advise you what to do. But talking it out is a therapy. So sometimes, because maybe we've moved into other communities where we're the only Black person in this community, that we can't talk with our neighbors and our friends. And so we need to go talk to our ministers, talk to our friends at church. And so would you say, that that's the correct thing to tell people
Yeah,
to do?
absolutely. Talk therapy is now the main form of therapy. We have moved more into making it a personal, humanistic interaction so that you feel like a person in the space. I also am really enjoying the virtual aspect that therapy has moved into. It has made it really easy to attract kids, attract the teens, because it feels more like a FaceTime interaction. I'm FaceTiming with somebody who is caring for me, involved in my process, and also can provide a little bit of different perspective. But it doesn't have to be I'm coming and sitting down and you're telling me about all of my issues. It's more collaborative. And we have definitely moved into that, definitely in the last 5 years.
Okay, well, what we're doing here today and what Sisters Saving Ourselves Now and Pittsburgh Mon Valley Black Women's Roundtable is a initiative of a larger national organization called the Coalition of Black Civic Participation.
Yes.
And so over 22 states, we have Black women working on how to empower Black women.
Mm-hmm.
So what we're doing here today is we're trying to present the information that's needed for women to help themselves.
Mm-hmm.
But sometimes we don't get the women out that need the help.
Mm-hmm.
What can we do? What would you say? What are some of the things we can do to get more people involved and out to hear this?
Absolutely. So for women specifically, I think we can all acknowledge that women take on a lot of different roles. So a great way to probably reach women in our communities is to go to the places that they would already be, at the schools, at grocery stores, at church, at the places in our communities where we commune, and provide them with a different perspective or opportunity to ask questions about maybe some things they are struggling with. Something I really like to do is go to different book clubs or fitness activities. If I know there is a African American yoga teacher doing an event, I will go and I will talk to them about their mental health in connection to whatever is happening around them, and it usually becomes a great segue into helping them get what they need.
Mm-hmm. Well, I'd just like to add one more thing because you talked about the URA and the programs that they have,
Mm-hmm.
and the Allegheny County Housing Authority
Yep.
has a program where what they're saying is that if you qualify, and we won't go through that, we'll probably tag that on our social media,
Yes. Yeah,
but
for sure.
you can go out and get a $150,000 house and get 80,000 of it deferred
Yes.
for 10 years,
10
and
years.
then dissolved after the 10 years if you stay in that house, and you're
Yep.
paying a mortgage of 70,000. And I think that's so important.
It is.
And the other thing is that when we buy a house, we don't buy that house necessarily to stay there for the rest of our house. We pay that $150,000 house. We maybe stay there 10 years if we're young enough, because I'm 29, that's my story and I'm sticking to it. And then we can move on to a much better and bigger house.
Mm-hmm.
And so now we might be buying a $300,000 home, and we're using that $150,000 home that maybe is almost paid for as our collateral. And we need to learn that, I think, as Black women, because we're in the process of building wealth. So when we pass away, that we can leave this $300,000, $400,000 home as equity for our children and our grandchildren. So, Ms. Edwards, I thank you so much for your time and for your presentation.
Thank you so much for having me, and I appreciate it. Thank you.
Thank you.